crosses out the 34.
He pulls on. Yeah, actually, didn't he sew on a different?
We wrote on and wrote
did he?
32 on because it's been 32 since.
Yeah, I've been 32 my whole life.
Yeah.
So that's awesome. So let's do this. Tell me about your experience here so far. This is graduation day for you. So, what's it been like for you?
In terms of the physical therapy combined with the chiropractic adjustments?
Yeah, sure. Let's do that.
I think it's a great addition because obviously you're going from hard tissue to soft tissue. You've got the whole package now. I really appreciate that. My particular situation, I'm doing some injury recovery from a bike accident combined with maybe some poor habits over the years whereby I'm at a computer and I've been sitting this way for 20 years. The shoulders are getting rounded and starting to get back issues because of that. So my goal was my why, or essentially was I wanted to get back to a comfortable posture. I wanted to get more mobility. I wanted to recover from some of the discomfort I have in my neck from that bike accident. So
when did that accident occur?
2 years ago.
2 years, okay.
Yeah.
And so what was limiting you? Where was the limiting factor? I mean, it's never just pain. It's never just something like that. What was limiting?
Well, from the bike accident, it was mostly neck compression there, and so we had to do some work on the C-spine.
Right.
In terms of the other spine, it's really probably golf and other athletic type endeavors and healthy aging. So my goal was to be able to in my 50s now, is to be able to be a very healthy senior, according to AARP. I guess you and
I got my card.
Yeah. So
yeah.
So that was my goal. My why is really healthy aging. I want to get max number of years, and I think in those terms. In my 50s, I want to be an athlete. In my 60s, I want to be a traveler. In my 70s, I want to continue to be very active. So
It sounds great. Yeah.
So that's kind of the plan.
And so when you start looking at it, what did you notice after the accident? What did the trend look like? I mean, obviously that's been 2 years. So what did the trend look like?
Yeah. Well, obviously, you get the spiral situation whereby you have pain and discomfort that causes you to be less active. You draw inward. You avoid situations. You avoid exercise. And that makes matters worse, makes your job harder. So it started to spiral down. So the goal really is to reverse that spiral and help the patient get back to the point where I can help myself.
I know you see it in all levels in there. You see people that are really just trying to learn balance drills, and then we have an athlete in you that's actually trying to get back to a fairly high level of performance. How'd it go?
Very well. I was really impressed. I didn't know what to expect because obviously this is brand new for me. It's brand new for you.
Absolutely.
But I learned a lot about some of the functional movements, the imbalance associated with the muscles and the muscle pairing. Dr. Jake had me do exercises that I thought were going to be very easy and just tiny little movements. I call them micro movements. Those tiny movements were very difficult at first. Even some checking in my chin, from this turtleneck, as he called it, bringing it all back here was very uncomfortable at first, and I couldn't believe how much discomfort it was the very first day. But by week 2, it was more comfortable, and now here we're week 8. I think great progress.
I have to tell you though, you're one of those guys that keeps showing up. I mean, you made a commitment. I'm going to do this, and you just did. I mean, I have to tell you, that's huge. It really is. What's a message of hope? What can you pass on to other people? I mean, obviously you started at what most people would consider to be a high level, but you saw it slipping. You're back obviously to a high level. You look great. Everything's moving well. You're basically done, ready to go off and do. Are you going to take some of those exercises with you? Let me ask that.
Absolutely, yeah. I used my camera. I took snapshots of all my exercises, and I can easily fold them in. You can do them anywhere. Fold them into my regular exercise routine as warm-ups, if you will.
Sure.
From there, that should prevent maybe a little bit of ergonomic work whereby I'm sitting in better chairs, better office equipment, those kind of things. It just 20 years of laziness, for lack of a better term.
You don't look all that lazy, but I get it. I mean, I get we're our worst critic.
Absolutely, yeah.
So, message of hope. What do you have for somebody out there that's seeing a spiral?
Well, the important thing is when you're in a hole is stop digging, right? So, So the first thing really is to try to get pain-free, and that will allow you to stop digging and come up north a little bit. I think you need help at that point. You need help to climb out of the hole. So that's where I think Rich really helps. in that situation. The earlier you can do it, just like you find any other situation in the body or the mind, the earlier you can find it, the better off you're going to be. It's going to be a lot less work if you can catch it early. Once you climb out of the hole, now I always say my doctor's job, your job is 1%, my job's 99%. So,
Absolutely.
But
it's great.
it's the education component where you can hand that off to enable that 99%.
Absolutely.
So that's what I came away with. More education really than recovery, because the body will continue to age and to degrade, and it's my job to fight that gravity and to fight the process.
Yes. Yeah. Rail against the night. Yeah.
Yes.
It's a good idea. Well, you've done very well. I mean, this is fun. It's always fun to talk to an athlete. My favorite part of the athletic mindset is that I'm just going to do this. This is what's going to happen next, and they just continue to do that. And the world kind of gets in the way sometimes, but you still found. I mean, you're a busy guy. You still found time. Show up and do your 3 hours with us a week. And dedicated yourself to that. And I'm watching you in there, you look pretty darn good. It is amazing though, our concept. And I want to ask this, going into it, did you feel like, oh, this is easy, man. I'm gonna crush this. This is gonna be no problem at all. Did you feel that way going into it?
I did. I thought maybe I wasn't a good candidate for it. But like I said, the smallest movements and the unusual movements compared to my normal workout routine and my normal body movement during the course of any given day were atypical, and that's what you really want. I wanted to go into that area of the unknown, and in order to make changes, you have to stress the body. It doesn't have to be painful, but it has to be stressful.
You have to challenge it to change it.
So,
yeah, it's kind of like if you're a great cyclist, right, and you're just fantastic at riding a bike, and I say, hey, come on a run with me.
Absolutely.
Or the other side's true as well, isn't it? I mean, if you can run till somebody gets bored of watching you, right, and then you get on a bike the next day and you can't walk.
Yeah, and so I would say that's a great metaphor for this. We always talk about cross training. If you're a biker, maybe run for a while, go swimming for a while. Add in some of this functional therapy as one of your tools in your toolbox in order to keep that cross training going.
Absolutely. I just want to say thanks. You're just terrific to be here.
My pleasure.
I really appreciate you.
Appreciate your help.
Graduate through the Bridge Rehab Program.
Wow.
This is Kent's why was he wanted to come in and be able to golf 2 back-to-back rounds and not hurt after. So he's well on his way to that. And I'm going to give him an honorary blue band. We started this program late, but had you been there, you would have given you a black, but I'm not a black yet. So
All right.
you can't pass me.
I'll come back.
Yeah, that's right. So that's for you. Congratulations. Any words of encouragement for those just beginning the program, or?
I just appreciate the learning experience and the recovery time. And I thought some of these exercises were going to be easy when I started with you, and they were nothing but easy. They were hard.
Pushed you, huh?
Yes.
Yeah,
and day one was real hard. 8 weeks later, a lot of progress.
Yeah, good.
So thank
Keep
you.
it going. Way to go. Good job.
Thank you.
Way to go.
Thanks. Speech. Come on, let's go to brunch.